Next, Mr. Jimenez, patient of Dr. Yassim and Dr. Koda.
Who?
The cystoscopy.
Okay. So Dr. Gomez got back to me. He thinks we can just treat him for the ear infection with augmentin and azithromycin, and he can see him in the clinic anytime, probably in 2 weeks after the antibiotic is stopped. The question is the cystoscopy and how that can be coordinated before he goes back to Linden Rehab.
Yeah, there's no way. Well, the only way is if the wife takes him over in a wheelchair or an ambulance. The ambulance would be the safest way, but that would be a cost to the family. Because the ambulance to Linden would be covered, but not from the hospital to an outpatient procedure. I was just talking to the wife about that.
So what does she want to do?
Well, she doesn't want to pay for an ambulance from here. She feels the procedure should have been done yesterday, and that for some reason, I'm just saying what she told me, the urologist dug in his heels, didn't do the procedure yesterday, and now today she's having to deal with this problem.
What about like when we have patients get radiation therapies or MRCPs and they don't happen here? They go to University Hospital?
Yeah. I called Uni and that's no problem. The ambulance would take him over there and bring him back, but because this is going to an outpatient procedure, they don't do that.
So let me just ask a question. If he's in the urology office, can we get an ambulance to take him from the urology office to the Smith?
Oh, I don't know. I don't think so. I think it needs to come from here. I can definitely ask, but like I said, since it's outpatient, we were thinking maybe we could sneak him back here afterwards and maybe have them come here and pick him up.
Okay.
Where is the cystoscopy?
Across the street.
On 15th, across from ER on 15th Street.
I know exactly where it is.
Yeah.
I had my colonoscopy across the street.
So is there an easy way to get there from here instead of going outside the building through ER to 15th Street?
Not anymore, there used to be.
Is he safe to be in a wheelchair?
Leslie?
Okay.
Leslie? Mr. Jimenez, you've been rehabbing him. Is he safe to be in a wheelchair?
He hasn't been in one yet, but he should be. Someone will need to assist with the transfer, but once he's in it, he should be fine.
Is that something his wife could manage?
Oh, God, no, but we can find someone to help out.
Well, once he's in the chair, could his wife manage that?
Sure.
Okay, so we'll do that. We'll put him in a wheelchair.
Invite an order, patient may be off ward for...
No, we can't do that.
We can?
No, it has to deal with, they can't do an outpatient procedure while he's hospitalized. He has to be discharged. So, what we will do is we'll discharge him. We'll get him over in a wheelchair. We'll have him come back here. He will not be admitted. And we'll have the ambulance pick him up here and take him to the Smith.
Because then the insurance can pay for it, but they won't from an outpatient procedure to Linden.
And if worse comes to worse,
Where's the procedure?
On 15th Street.
if worse comes to worse, I will walk him over in the wheelchair.
See, I offered to do that.
I'll do it. It's a nice day out.
All right, so that's what the plan is.
So he'll borrow one of our wheelchairs, and I feel comfortable taking him over. Wait, we don't even know what time yet, do we?
I'll call them.
Okay, all right then. Because Linden Rehab is ready, and we'll sneak him in and we'll sneak him out, and we'll just call for an ambulance.
But we won't be able to release the bed,
Why? Why can't we release the
because
bed?
the ambulance will come up here.
What? Okay, that's what we're saying. After we sneak him back here, then
But if we discharge him and release the room, when the ambulance comes, he won't be in the room, somebody else will. So how do we connect him with the ambulance if he's not in his room?
Oh, well, can't he just be waiting in the waiting room?
Yeah, the waiting room.
Can't you sign a temporary release from the hospital?
No, we've just gone over that. Look, because it's an outpatient procedure. I think what happens is it screws up with the billing or something. So, he has to be discharged.
Maybe we,
Okay, we have a plan. We're gonna walk him over. No sneaking over. All right, who's next?